Good evening, everyone, and welcome to Motion Sickness, Helping the Client Pet Bond with Amy Newfield, CVT, Veterinary Technician Specialist in Emergency and Critical Care. I'm Christy Keith, Senior Communications Strategist for Fear Free. Before I introduce our speaker and get started with tonight's presentation, I'd just like to cover a few little housekeeping things. First, we'd like to thank our friends and fear-free sponsors at Zoetis Pet Care for making this webinar possible. And we'd also like to thank all of you for making time for this webinar this evening. Next, and I know a lot of people will have questions about this, yes, CE, 1 hour of race-approved CE is available for this webinar, but only for those of you who are here viewing it live. There is no CE for anyone watching the recorded version of this webinar. For the live attendees, I'll be sending an email out immediately after this presentation. In it will be a link to the survey that you need to take to get your CE. In the final question in the survey, there is a link to download a CE certificate that you can print out and fill in. However, if you don't provide accurate contact information and complete all the questions in the survey, RACE will not process the CE. So even though you have the certificate, you will not actually receive the credit. So make sure that your contact information is accurate, because a lot of times people might typo their email address or their name in some way, and some people for some reason don't want to put in a valid email address. Don't make that mistake this time. The survey is going to close. The survey for CE is going to close on Tuesday at 3 p.m. Eastern United States time. So please take it as soon as you receive the email. Don't leave it to the last minute, because there are always a few people who miss out on their CE because they didn't open the email soon enough. If you don't receive the email this evening after the webinar, you can email me, Christy Keith, at fearfreepets@gmail.com. Contact me as soon as possible tomorrow morning, because after the survey is closed, I won't be able to help you. And I want to repeat that email address. It's fearfreepets@gmail.com. This is not the official customer service email address we have you contact for most things. This will go straight to me so that I can help you with your CE questions, and I'll be able to handle them anytime. If you email the office, they're going to have to forward it to me, and it'll just delay everything. And obviously, as I already mentioned it, there will be a recorded version of the webinar. It'll be available within around a week at fearfreepets.com/webinars. And I'm almost done here, if you have any questions for our speaker during the webinar, please send them using the Q&A interface. We'll get to as many as we can at the end of the presentation, but please try to get them in as they come to you. Don't hoard them. We all know hoarding is bad. And now it's going to be my pleasure to introduce Amy N. Newfield, CVT, Veterinary Technician Specialist in Emergency and Critical Care. Ms. Newfield is currently employed with Blue Pearl Veterinary Partners as the National Veterinary Technician Training Manager. She sits on the Academy of Veterinary Emergency and Critical Care Technicians Board as the immediate past president. She is well published in over 15 subjects, is an international speaker, has received numerous awards, including 2 Speaker of the Year awards, and is highly involved in her community. She lives in Massachusetts with her wonderful furry kids. Thank you so much for being with us tonight, Ms. Newfield. Please take it away.
Awesome. Thank you so much for a wonderful introduction. And again, I'd like to thank the folks at Fear Free as well as Zoetis for having me this evening. So we're going to talk about motion sickness, and we're going to kind of go through what it is as well as some ways that you can treat it. But we're going to mainly focus on helping the client and pet bond, because when you have a dog that is vomiting in the car, you don't want to put them in the car, so they end up staying home. My email address is at the bottom there. It's amy.newfield@bluepearlvet.com. You guys are always welcome to email me. I will get back to you, and I am going to go ahead and start. I am normally a very fast speaker, so I try to slow it down a little bit for webinars, but I've got a lot of material to get through, so we'll take questions at the end. There it goes. All right. For some reason, it did not want to advance. It's just going to make me upset on the very first slide. So an owner walks into your clinic. I think we all know how this goes, right? We have seen this. We have been participating in this, unfortunately. They come in, they've got that disgruntled face. They say, I need some paper towels. He just vomited all over your car, right? And you already know how it's going to go down, right? For the next 10 to 15 minutes, you've got to help this client with the vomit, right? So I know everyone thinks we play with puppies and kittens all day long. That's the only thing we do in our job. But unfortunately, this is the other thing sometimes we do in our job, right? We're going to help her clean up the car. It's going to be one of those things where I've literally gone out and helped clients clean up their car. You listen to the client, right? You feel bad for them. It's disgusting. And you know how vomit just leaks into the seat wells and it's just horrible. Or you're actually just in the hospital trying to clean the vomit off the dog, because dogs, when they vomit, I don't know why, they like to dance in it. And it's usually a young dog that does it. Now they've danced all in it and they're literally covered. Or you're just holding the dog for the client and you're waiting and you're waiting and you're waiting, because car cleanup takes a very long time. So this is now a waste of your time. You've got better things to do with your time, and the appointment's now running late. So everybody's frustrated, right? So why do we care about motion sickness dogs? Some interesting statistics, which when I was researching this topic, at this point it's been at least 10 years, I was surprised, but also not shocked because of my experience working in general practice. Nearly half of dog owners, 48%, said that their dog experiences motion sickness symptoms. And restlessness is up there at 17%, whining, whimpering, and barking. You know, they're feeling not great in the car. They know they might get sick. Excessive panting, right? We've all seen that one, 14%, where they're excessively panting. Their lips are getting back further and further, right? That sort of thing. 2006 pet owner market research study said that roughly 7.2 million dogs suffer from motion sickness every single year, but only a quarter receive treatment. And a lot of times that's because the owner thinks nothing can be done, right? This is just the way it is. There isn't anything, or they've tried maybe one drug, it failed miserably, so they've given up, right? So what ends up happening is we have motion sick dogs that are simply just left home more frequently. Some newer recent data in 2009, a study said that 92% of veterinarians and technicians felt it had a moderate to significant impact on the owner quality of life with that dog. I completely agree. I've actually been very fortunate. As an adult, I have had up to 3 dogs at any one time, but I have had experienced 4 dogs as an adult in my adult lifetime. I grew up with dogs as well. And I've just been really fortunate that none of them have suffered from motion sickness in the car. But when I first got my border collie, who is now 8 years old, and I picked him up and put him in the car, we started driving. And he vomited. And immediately, I think sometimes it's bad to have medical knowledge, because when you work in veterinary medicine, you always go worst case scenario. So I've only had this puppy for literally 10 minutes. He vomited. I'm crying. People are wondering why I'm crying, because I just got a puppy. I should be ecstatic, right? Immediately I go, that's it. He's motion sick. He's never going to be able to go on car rides. And I'm a trail runner. So I'm always, almost every day, my dogs are in the car driving with me to a trail so that we can go run in the woods. And so I immediately thought, that's it. He's never going to get in the car. He's going to be motion sick his entire life. Oh my gosh. And he did experience true motion sickness for the first couple months of his life, but luckily grew out of it. We also worked behaviorally with him, but at the time there was only limited things that we could try. So absolutely it affects the quality of life of that dog, because the owner now dreads the experience of putting that dog in the car. And dogs travel with us all the time, right? 89% felt it had a moderate to significant impact on the pet owner bond. So it's not just about a sick dog, it's really about that entire relationship that we have with that owner and that dog, right? So some even newer data, Zoetis Global Market Research in December 2018 published this study. 44% of dog owners were not aware that medications for motion sickness were available. They just simply didn't. Or again, maybe they've tried one thing, it failed miserably, and they just just kind of gave up. 46% of pet owners say motion sickness weakened the bond or relationship with their pet. So again, we've seen multiple studies, multiple data stating that when you have a dog that's experiencing motion sickness, unfortunately, it does break their relationship with them. It is a different type of relationship than that they were hoping for. Some other interesting things, another study on a file by Zoetis, only 6% of dog owners who observe the signs actually report to them to the veterinarian. A lot of times they're coming in for their wellness exams, right? They might have just vomited in the car and maybe they just quickly clean it up, or maybe there was just some drooling or some panting. And we just kind of ignore that, right? Because we want to get through the wellness exam and we forgot to tell the veterinarian. And then on the way home, we just go, oh, the next time I see them, I'll let them know that he vomits in the car. And they forget, right? Interestingly enough, in terms of human studies, motion sickness is well documented. Probably a lot of you on this webinar this evening know what I'm talking about, right? Roughly 33% of human beings become motion sick with mild circumstances, and 66% of us, more than half, in severe conditions. I agree to that, absolutely. I like to sit in the front seat of a car. It's not to say I can't handle the back seat of the car, but in the back seat of the car, there are certain rules and regulations that have to happen so that I don't become motion sick. I cannot read in the car. The windows might need to be left down. I have to focus on what's going on the outside, right? 50% of NASA and astronauts actually become motion sick. And I think that's space is probably the worst place to experience motion sickness, hands down. Interestingly enough, it's poorly documented in cats. And we think some of this is because cats just don't travel as much with their owner. I'm not trail running with my cat. You know, I've asked her, but her name is Wobbles. So I'm sure that you can imagine that she actually does wobble when she walks. We all have those special needs animals in our lives, right? So Miss Wobbles is not a trail running cat. So she doesn't, her idea of going in the car is terrible because we only end up at the veterinary hospital, right? So we do have a different relationship with our cats than with our dogs. So let's really dive into what is motion sickness and how can we help our dogs in our lives, right? True motion sickness is hallmarked when the dog vomits only when the car is moving. This is really important. Once the car stops moving, the dog ideally should stop moving or stop vomiting because again, it has to do with motion, right? So let's kind of talk about the causes of this. We don't fully understand it in both human or veterinary medicine. It's kind of thought that it occurs when there's a disturbance in the inner ear from this repeated motion, and it involves the vestibular system in some sort of way. Your vestibular system is your balance system. It lives within that inner ear. It's most commonly reported in our puppies and our young dogs. There's a high incidence of it. And in fact, a lot of them do actually outgrow it. Like thankfully, my border collie, whew, I feel like I dodged a bullet because again, I went to mass hysteria, right? You know, and I feel like we've all done that. I'll tell you, this has nothing to do with motion sickness, but I literally just went mass hysteria again with my border collie. There was the tiniest bump on his skin. I immediately decided it was mast cell tumor. And because I work in a specialty hospital, I immediately drove in that day, even though I wasn't working on the floor, and was like, somebody needs to look at this and aspirate it immediately. So we do get that luxury of doing those crazy owner things that, you know, we make fun of owners for, but yeah, it's super important that we get to have that little bit of a luxury. So anyway, not mast cell tumor, by the way. We're all happy to do it, but I go straight to like the worst case scenario. So anyway, he outgrew it, but not all of them do. So let's talk about the different theories. Again, I don't think we fully understand why it happens. We know it has something to do with the vestibular system, but really it also has to do with the eyes, the ears, and the brain, and kind of playing a role between the three. It's a sensory issue, but what is the disconnect that then causes the actual vomiting, right? The most accepted theory in both human and veterinary medicine is when the eyes tell the brain that the body is not moving, but the inner ear says, no, no, we are moving, and eyeballs, you are lying to me. So case in point, the car, right? If I'm sitting in the back seat of the car, I want to look out. And when I look out, the things outside of the car are not moving, right? Only the car and me are moving. So my eyes say the outside's not moving. The mountains are not moving. The trees are not moving. They are staying stationary, but I am moving. And this disconnect, this confusion between the signals, unfortunately, leads to that motion sickness vomiting response that we're dealing with. Another theory is that sensory confusion causes signals to the brain similar to those actually involved in an ingestion of a neurotoxic substance. So the body, the combination of the signals actually says, hey, there's something really bad and toxic going on here, and I am going to just cause you to vomit it out of your system, right? And so it sends those signals to the Emetic Center, and now, unfortunately, the patient is now vomiting. Let's talk about the vestibular system, okay? We talked a little bit, it controls your balance and your spatial orientation. It provides the information about movement and balance, and it's actually, again, part of your auditory system, lives in your inner ear. So how do you get that sick stomach? Nausea and vomiting is generally generated from two centers of the brain, and we're going to break down these different centers. Your emesis center and your chemoreceptive triggering zone, or also known as your CRTZ. So those are the two different types of areas that we're going to go ahead and get those signals from. Your emetic center, basically all vomiting stimulation, including that from the vestibular system, converge eventually onto the emetic center. And you can see that in that little pink area right around the back of the brain there. So there are a bunch of neurotransmitters and receptors in your emetic center. And what happens when you look at this picture here, when you connect one receptor to a neurotransmitter, then when they connect together, that's when vomiting forms. But there's a bunch of neurotransmitters and receptors. And so in order to completely block all vomiting whatsoever, you'd have to block all of these so that they can't connect with their counterpart, right? It's kind of like a piece of a puzzle. So if we look at, for example, the picture at the top, we've got that NK1 receptor, and the little neurotransmitter is going to be your substance P. If substance P connects in with the receptor NK1, vomiting occurs. So obviously, when we're going to talk about prevention of vomiting and motion sickness, we're trying to block that piece of the puzzle from actually getting in there, right? And if we can do that, then ideally we're not going to have the vomiting response. So some key neurotransmitter and receptors that are involved in vomiting: neurokinin 1, NK1, substance P, serotonin, adrenergic, and glucocorticoid. Some others that are involved in vomiting: your D2, your dopaminergic, your histaminergic, your serotoninergic, your endorphin, and your cholinergic, your M1 and your M2 receptors. And then we've talked about the emesis center. There's another key component into vomiting, which is your CRT zone, your CRTZ. This is the area of the medulla oblongata of the brain. It receives inputs from hormones and parts of the body and communicates with the vomiting centers to initiate vomiting. Within the brain, within that medulla oblongata, if you look here, it's at the base of the brain there. The neurotransmitters and receptors that are implicated in stimulating this particular zone are some of the same similar ones that we see in the emesis area, right? So acetylcholine, NK1, sound familiar, right? Substance P, dopamine, your 5-hydroxytryptamine, your histamine, and your norepinephrine. So we can kind of see all of these, and some of them are in both of them, and some of them are just in one or the other area. So how do we stop vomiting? Like I said before, super simple, right? Easier said than done, right? If we combine a neurotransmitter with a receptor, we get vomiting. So if we are going to develop a drug, or if we have a drug, we want to say, for example, take dopamine and block it so it can't combine with the receptor of dopaminergic, right? When we look at, at the bottom, the norepinephrine, we don't want it to combine to adrenergic, because then we're going to get vomiting. So think of, the middle of this is putting a drug or putting something in there to block it so that they simply don't combine. We don't put the pieces of the puzzle together. But you can also, in this chart, therein lies the problem, right? We've got 6 various combinations that can go on here, right? And most drugs are only going to do 1 or maybe two, but most of them just do one blocking. So if you've ever had a patient that has come into your hospital and you just start prescribing every antiemetic known to mankind, that's because your veterinarian is trying to prescribe, and blocking each one of these neurotransmitters and receptors. So let's dive into motion sickness, right? So for example, some of these antiemetics we're very familiar with, right? Metoclopramine, also known as Reglan. This is a D2 dopaminergic antagonist, right? So we're trying to block that receptor, obviously. Zofran, ondansetron, Pepcid, famotidine, right? And apomorphine is a dopamine receptor agonist. So each one of these only does one of the things that we talked about. So the vomiting associated with motion sickness usually affects one of these three things: your M1 cholinergic, your H1 histaminergic, or your NK1. So let's identify, therefore, how we can go ahead and block those three when we're dealing with motion sickness. Because motion sickness obviously is a different kind of vomiting than we're dealing with, say, gastrointestinal disorder, foreign bodies, things like that. That's completely separated out. But these three are the ones implicated typically in our motion sickness. So in the Emetic Center, NK1 and alpha-2 adrenergic receptors are the clinically most important for vomiting. This was discovered in the late 90s, early 2000s. And in fact, interestingly enough, the discovery of the NK1 receptor antagonist really helped human patients to alleviate nausea and vomiting for those undergoing cancer chemotherapy. This was a big deal breakthrough because chemotherapy patients experience a lot of vomiting, right, and gastrointestinal effects. So if we can stop them from vomiting, well, gosh, that would be a great thing. And the discovery of that NK1 receptor really provided a lot of relief, and still does to this day, for those patients receiving chemotherapy. So let's focus on treatment of motion sickness. Treatment needs to be aimed at preventing those signals, right, from multiple receptors. If we can get all three of those receptors covered, that they can't actually connect, ideally vomiting from motion sickness shouldn't really occur. But we also need to focus on behavioral, and we also need to focus on environmental. So let's talk about clinical signs. We kind of talked about them a little bit, but let's dive a little bit more into it. It occurs only when the dog is in motion, really key. So if your client says, he was at home, he didn't want to eat, he vomited, and then we put him in the car and he vomited again, maybe it's from motion sickness, the one in the car, but we should probably investigate why he was vomiting when he's in a house that's not moving, right? They have excessive drooling, pacing, panting, swallowing, or lip licking. It's quite the production when a dog or a cat vomits, but particularly dogs, I don't know what it is, but you've all seen it, right? So they have these long strings of drool that come out, and then their lips get drawn back tighter and tighter. They almost look like they're smiling, right? Then there's a lot of abdominal heaving. Some of them moan through it. There's like a production. It's almost like a weird ballet. And then you have, it's always this noise, right? You all know what it sounds like, right? And then it's disgusting. This sounds so strange, but I'm so happy that humans don't do the entire 2-minute production before they vomit. We just sort of vomit, right? We don't announce for 30 seconds to a minute, like, hey guys, I'm going to do this weird thing where I just let you know it's about to happen. As a pet owner, we're eternally grateful that they do this big production, because that allows us to run and grab stuff, right? And put it under them, ideally, right before, so they don't mess up our floors. But it is obviously that abdominal heaving, that vomiting is pretty violent. It's very violent. Vomiting may occur immediately following the onset of motion, or it may occur late, sometimes hours later, but it might be right after they got out of the car, right? Their brain was so scrambled the whole time. They walk into the veterinary hospital and vomiting. Vomiting may occur when there are specific factors added to motion, like temperature, humidity, positioning of the dog. Again, we've kind of already talked about this, but some of you know exactly what I'm talking about. You're only going to sit in the back seat of the car if you know you can roll down the window, as long as it's not too humid and you can't possibly read anything, because you need to look out of the window and make sure that you don't get motion sick, right? So you know exactly what I'm talking about. It's easier sometimes in people because I know what works for me. But in our dogs, I can't say to my dog, like, hey, buddy, you know, if I lower the window, does that make you feel a little bit better? So sometimes it truly is trial and error with these guys, but these are suggestions that we can offer to clients to say, hey, have you tried maybe cracking the window a little bit? I know I feel better when air blows on my face. I'm not feeling great, right? Or you also feel better, at least I do, if I'm taking a boat ride, if I've eaten beforehand. If I go on an empty stomach, forget about it. So early intervention is really key, right? I mean, I think it seems like common sense, but if you know that your pet is a motion sick candidate, we don't load them up with the biggest bowl of food ever and then throw them in the car where it's hot and humid, and then just take them for a car ride. That is just a recipe for disaster, right? So we don't want to feed them at least a couple hours prior to the trip. You know, it's going to be hard in some of our dog species, but ideally we try to keep them on an empty stomach. So if they vomit, it's a smaller amount for us to clean up. And again, early intervention, specific factors, right? Allowing that fresh air. It's hard. Yes, we want to be able to restrain our dogs in the car so they're not popcorning around and becoming an endangerment to themselves and to us, but sometimes allowing them to stand is the big deal. Small dogs can't see out of the window because they're small, and a bigger dog can sit and look out the window, and then now they have some spatial orientation. Small dog, they can't see, they don't know what's going on, they're just basically in a metal box, and they might vomit simply because they can't see, right? Unfortunately, motion sickness can lead to behavior problems, and this is where that client-pet bond comes into play, right? So just think about it on the pet's perspective. Every single time you get put into this metal box, right, that causes some level of fear and anxiety. And this can cause aggression against the owner. Why would they want to go into the car, right? It's a miserable experience. You put them in the car, and even if you end up at the dog park, some dogs can't come up with the rationale like that 20-30 minute car ride was worth it because it was basically torture for 20 to 30 minutes, right? So they start getting really fearful about getting into the car. And now, unfortunately, it's a learned, not anticipated scared response sometimes where if you've ever been so nervous that you have GI upset, and you don't have to like let me know this, but obviously some of us, when we get really nervous, some of us unfortunately have GI upset either from one end or the other, right? Our dogs can experience the same thing. So now they see the car. They know it's terrifying. Nothing good comes of that. And yes, we end up at the dog park, and that's fun. But that 20 minutes ride, I'm shaking, I'm drooling, I absolutely am heaving, I don't feel great, I'm restless, I vomit all over the car. The owner's pulling the car over. Now they're yelling at me, right? I've got vomit all over me. This is a nightmare. I am so nervous about getting into that car now. Now I'm vomiting outside of the car. So you can actually have dogs that vomit in anticipation of riding in the car, and it can truly become a learned response. Now think of it from the owner's perspective, right? Just a nightmare, right? Forget about it. I don't want to take this dog on walks. I don't want to take him anywhere. He can stay home. I don't want to take him on family vacations. No, I don't want to bring him over to the friend's barbecue house. Forget it. He could just stay home by himself. And that's not really the relationship that we love about our dogs, right? We love our dog relationships because they're so integral and they get to come with us in so many wonderful places. So being able to help with this actually helps to form that client and pet bond a lot stronger. We can try to do behavior modification in the form of desensitization, right? So desensitization is where you slowly introduce the thing that upsets the animal, and they get used to it. And that can take weeks or months. So if we do have a fearful dog, right, we want to try to make the car as positive as possible, right? Until we're able to figure out a drug combination that works for the motion sickness, we should work on desensitization. It's important that we don't elicit a response. And so that's unfortunately where sometimes we backfire a little bit and go backwards a little bit on desensitization, because unfortunately we then need to take the dog someplace. I always give the examples of arachnophobia. So I am afraid of spiders. It doesn't matter if it's a spider the size of a pencil lead or it's a gigantic tarantula. I am sure it's going to lunge for my jugular and kill me. Okay, so I know it's completely irrational. Spiders are nice. They help save the environment with lots of bugs, yada, but I really honestly get nightmares over spiders. Don't ask me why. So it's completely irrational. If you wanted to try to desensitize me to a spider, you would have to put the smallest spider ever across the room. It's not allowed to run at me, because you know how you have those running and jumping spiders. It has to stay in the corner of the room. And you're going to feed me chocolate. And you're going to make this little tiny spider that's barely moving really fun for me. So I'm going to start to associate a tiny spider with chocolate. And then the tiny spider is going to get closer and closer until I'm like, oh, look, it's so adorable. This tiny spider standing right next to me and I'm getting fed chocolate. We're going to increase it. We're going to take a bigger spider, put it in the corner room, feed me lots of chocolate. It probably can advance a lot faster because I'm like, cool, I'm still getting chocolate. I love it. And then eventually move up to tarantula-sized, jumping, Cujo-like spider. That spider's going to be in the corner of the room. It's going to start lunging and jumping and doing those crazy like moves that spiders sometimes do. And it's going to get closer and closer. But by then I've been desensitized. And I'm going to see that big spider and be like, wow, that's just a nice little spider like all the other spiders. So that's what happens with cars, right? Dog sees cars. Before we even get the fear response out of the vehicle, we're going to have a good response outside of the car, right? We're going to toys, treats, whatever, and we're just going to get closer and closer to the car so that all we're doing is walking around outside the car and it's fun. Then we're going to open up the car door and we're going to encourage the dog to just look inside, eventually getting inside the car with his toys and all that fun stuff and making it super fun. And then eventually really rewarding. You've jumped in the car, you're getting back out of the car. Woohoo. And then so eventually that fearful dog who's afraid because of the motion sickness has learned, I get in, I enjoy the space, it's super fun, I'm not so scared of it, and now I'm not biting my owner who's trying to push and shove me into the car. Where we get into trouble is all of a sudden the tarantula drops on my head, right? Or if all of a sudden that pet owner has to take that pet to the veterinary hospital and the desensitization hasn't been completely followed through and done yet, then we backfire a little bit, right? The problem is behavior modification using systemic desensitization isn't going to help the vestibular issue. It just helps the fear-based response that that dog has to the vehicle itself, right? So we're going to be able to help with the behavior aspect of it, but the dog's still going to vomit. So we do have to work on appropriate car riding behavior at the same time. We have to work on car is fun so that when we find a drug combination or something that works for the motion sickness, they want to get in the car with us and go enjoy the park, right? We're all of our puppies up for success. And this is where the veterinary team, particularly technicians and assistants, play a huge role, right? Any puppy or dog that's fearful of the car, we have to have that conversation with the owners. Make it fun, right? Don't make the car move. Moving is scary. And so again, going back to that systematic desensitization, turn on the car, make it lots of fun, drive for 30 seconds, stop, reward the behavior. Woo, it's great fun in here. And then slowly increase that time, because that's really key, because a lot of these motion sick animals get so afraid of the car, we ruin that client-pet bond because of it, right? So let's dive into the pharmaceutical options, right? We've talked about windows being, cracked and maybe allowing dogs to see out of the window and not feeding them right beforehand and all the behavior modification. But still, there's something going on in the inner ear, and despite all of that, that animal's still going to unfortunately not feel great and start unfortunately vomiting. So let's kind of go through all the drug options. Acepromazine and Chlorpromazine. If you have been in the veterinary clinics for a long time, and by long time I mean like more than 15, 20 years, we used to give Acepromazine to everything, every way possible, right? Both of these drugs are phenothiazine drugs, and they used to, let me say that again, they used to be prescribed for motion sickness. Acepromazine in the past was actually labeled for the prevention of motion sickness. Oopsie, our bad. It turns out it doesn't do any of those things. That was a misrepresentation of the drug. So it is a sedative and it is a tranquilizer. So I can tell you that actually 22 years ago, I actually would give owners Acepromazine to help prevent motion sickness in their dogs. And all we were doing was drugging them and sedating them. And now they were still vomiting in the car and still, unfortunately, having those same motion sickness signs. They were just drugged out of their mind, laying in a drug-induced coma on the floor, drooling, vomit out of the side of their mouth. So apologies to our veterinary patients from 20-something years ago. Chlorpromazine has not ever been labeled, but for motion sickness. is actually labeled as an antiemetic and as well as a tranquilizer. So we typically don't use either one of these, and that's why we typically don't use them, because we have come a long way in terms of drugs. So let's talk about some more modern options, right? And again, this just kind of goes again what I just said: significant sedation for a prolonged period of time, and then they just get confused. We also bottom out their blood pressure with both of these drugs, by the way. So again, we no longer recommend either one of these drugs to prevent motion sickness. All we're going to do is have a dog that's drugged out of its mind, still miserable, but just now sedated miserable, right? All right, more modern drugs. So we have Dramamine, Benadryl, diphenhydramine, diphenhydramine, and dihydrogenate. Excuse me, it's late at night. I can't pronounce words at this hour. Both of these block your histaminic receptors, your H1 receptors. Apologies, my goodness. So dihydrogenate is 54% diphenhydramine, so they're very similar in their compound nature. Neither one of them can you use in pregnant dogs. Both of them we recommend about 30 minutes before the car ride. They last about 3 to 6 hours. There are some adverse reactions. So you can get central nervous system depression. In fact, some owners find this to be a very nice thing, right? With your diphenhydramines, you give them this, they might actually have a little bit of a calm sedative effect, but they also have anticholinergic effects. So they tend to get dry mouth. They tend to want to drink more water, urinary retention as well. Less common diarrhea, vomiting, and anorexia. So yeah, the irony to this is that in some of our patients, there's a certain subset that it actually induces vomit in them. So I feel like with both of these drugs, it's definitely, we will try our patients on them. They either work or they don't, right? And I feel like that's the same with human beings as well. I know people who are like, yes, I take Benadryl for motion sickness, bam, I am no longer motion sick, it's great. And then I have other people who are like, nope, doesn't do anything for me at all. So I think the same in my personal experience with our dogs and using these, same sort of thing. Meclizine, Bonine. So this blocks that H1 receptor. Again, sort of that same basis we were talking about before. It has to block a receptor combining with the neurotransmitter, right? So each one of them just kind of does one of them. We don't have a ton of information relating to how it works in our dog species. We don't fully understand why it works. The most common side effect, also sedation. So with the other class of drugs and this class of drugs, we're going to get some sedative effects. No studies on pregnant dogs, important to note. It's actually the first drug of choice for vomiting associated with pregnant women, however, human women, because it's thought to cause less toxic side effects with the fetuses. But in dogs and cats, we don't have studies with pregnant dogs or pregnant cats in the use of this drug. So safest rule of thumb is just don't use it, right? But again, it might work with some of our veterinary patients who have motion sickness. And then I think we're all very familiar with CERENIA, also known as maropitant citrate. So this was released by Zoetis in 2007. This is the first FDA drug approved for preventing the vomiting associated with motion sickness in dogs. And we're going to talk about it because when it came out, I am someone who doesn't believe things unless I see it personally. So we're going to talk about one of my colleagues' friends' dogs named Chicklet, because we did a little in-clinical trial study using this because Chicklet was one of the worst motion sick dogs I've ever known in my entire life. So how does this work? Okay, again, it has to go ahead and block one of those receptors from connecting with the neurotransmitters. In this instance, it's actually substance P. Substance P is found in the highest concentration actually in the Emetic Center. And maropitant was discovered actually back in 1931 by Ulf van Euler and John H. Gadam as a tissue extract that caused intestinal contraction. So substance P is a neuropeptide. It helps to regulate your mood, your anxiety, your stress, your respiratory rhythm, pain, and then nausea and vomiting. And it works when substance P binds with NK1 receptor, obviously vomiting occurs. So again, this is going to stop that from happening. There's some pretty impressive studies out there. I think we all have used maropitant when it comes to, your common GI dysfunction, right? Your vomiting and diarrhea, dog comes in and I feel like it's just one of those things a lot of us do, right? Sub-Q fluids, maropitant, dog feels much better. It's kind of one of those things we do over and over. But when it comes to motion sickness, there are some very impressive studies with the use of this drug and how it correlates to specifically motion sickness. Study of 122 dogs with motion sickness that was dosed 2 hours prior to travel, only 7% vomited after being administered maropitant, as opposed to 55% vomiting after receiving the placebo. So let's talk about how we use this drug for motion sickness. It is different than an animal with GI upset. So the dose that I'm going to give you always shocks everybody. Anytime I do this lecture, everyone's like, are you sure about that? I am sure about that. Okay, you can check your package insert if you don't believe me. So the prevention of vomiting due to motion sickness is through the oral administration tablets of 8 milligram per kilogram once a day. It is a higher dose, okay? You can do it for up to 2 days. So this isn't going to be a week-long thing. This isn't going to be 5 days. It's not going to be 3 days. Up to 2 days, 8 mg per kg once a day. Here's where it gets a little bit tricky. The dogs should be fasted 1 hour prior to administration and then dosed at least 2 hours prior to travel. The dogs need to be at least older than 16 weeks. So this is also older than your sub-Q dose, you know, that you can give for just nausea, because that's dosed at a lower dose. Again, the motion sickness portion of this is different dosing instructions, and that's really important. It's all on the package insert in case you guys forget. The best results, you can't feed them for 1 hour before the dose is given. So if you, for example, have an owner who's going for a car ride, you know, in the morning, just have them get up, right? Give them the tablet, ideally almost immediately, and then go ahead and feed them, you know, before or after, but you got to make sure that you don't do anything for about basically an hour. So just get up super early and do it, and then they can go on a car ride and it'll be super fun. It takes 1 to 2 hours for maropitant to take effect. So you can, you know, play around with that and see how close you can get to getting that dog in the car. But 2 hours is the safest bet, right? And the crazy studies that have come out are 86% of dogs given it only 1 hour before the ride did not vomit. So that's also pretty impressive. So statistically, even if we want to push that only to 1 hour, we get up in the morning, we take an hour to get ready, but we've already given our dog the maropitant and they're already fasted, boom, get them in the car. Ideally, 86% of them aren't going to vomit. So it's pretty impressive. There is some important safety information. So, you know, again, for acute vomiting, for your GI upset, different dosing, and you can use it at a lower dose for dogs that are younger. But in our motion sickness dogs, right, 4 months or older at that 8 mg per kg. I can't stress that enough, okay? 4 months or older at that higher dose. Safe use has not been evaluating cats and dogs with GI obstruction or those that obviously have had toxins. And we do want to be careful in dogs that have some liver dysfunction. That's really important as well. I love this chart by CERENIA because it's actually adorable, sad, but adorable. I love the colors. Visually, it's appealing. I'm sure you all have Zoetis reps, so just ask them for one of these wonderful little cards. You can post them on a wall or you can hand them out to clients. But I think it really drives home the point because, again, remembering that small percentage of clients that actually realize something can be done to help alleviate the vomiting and the illness that my dog is having in the car. If we can do something with that, then we can create that better client-pet bond, and that's really key. So having them out will trigger the client to say, oh, you know what? I think my dog is experiencing motion sickness, right? The vomiting, the excessive panting, the excessive lick-lipping, all of them sometimes at once, right? The drooling, the restlessness, the shaking, the inactivity, all those things are signs. So now let's dive into alternative options, right? Because we've all heard it. So let's see what works and doesn't. I try really hard when I'm putting together a presentation to dive into data-driven evidence so that I actually have facts and I'm just not going, well, we've always done it this way, because we always did it this way sometimes isn't right. So let's talk about acupuncture and acupressure, right? It has unknown efficacy when it comes to motion sickness. Now, I love acupuncture. My old lady dog is actually getting acupuncture right now. So I can say that in my opinion, and there's a lot of clinical studies when it comes to arthritis and stuff like that, acupuncture does seem to help with those things, but we're talking motion sickness, because I've occasionally have people say that I'm bashing on acupuncture and acupressure. I'm telling you about studies and data-driven evidence for one particular thing, which is motion sickness, right? So there seems to be more studies in humans showing the benefit of acupuncture to help alleviate motion sickness signs over the benefits of acupressure when it comes to motion sickness signs. There is an acupoint. It's most commonly used, called the pericardium 6. Some of you probably swear by this, right? So if you ever have been on a big cruise ship or a boat, some of you have bought those wristband buttons, right? There's a little wristband, it has a button, and it pushes actually on your pericardium 6, which is located on the inside of the wrist, about 2 inches above the center of the wrist crease. And it's an accepted theory that it actually can help human beings. Humans who experience motion sick will put these little wristband buttons on. You see them on the cruise ships, they're cruising around with the wristband buttons, and they swear it helps alleviate the motion sick signs. What about dogs? We don't really know. We do know that it's not tried that frequently because both acupuncture and acupressure seem to be expensive in our dogs. There's also not a lot of positive research using wristbands in dogs or continuous acupressure. And so we do have owners every so often who buy wristbands and try to put them on their dogs. But there's been no data-driven studies with regarding motion sickness in dogs and showing that those wristbands or even acupuncture will help alleviate the signs of motion sickness. Ginger. I mean, I feel like this is everything. Like when you have an upset stomach, what do? I need some ginger ale. I need ginger cookies. Does it really work? Let's dive into it. There's a lot of positive research actually in human medicine. There are several studies that have shown there has been a reduction in motion sickness when ginger was used. But an old study, 1984, obviously NASA has a vested interest in preventing motion sickness, because I don't want to be the astronaut sitting next to the other astronaut when he vomits, but I would gather that is pretty tragic experience in space, right? So in 1984, NASA sponsored a study at LSU, which concluded that ginger given 2 hours before the motion event did not seem to reduce the signs of motion sickness. And they can put their NASA astronauts through pretty much the worst motion sickness, gravitational force things that you could imagine, right? In veterinary medicine, there's been some studies out there that have shown that maybe there's a couple little benefits out there, but how efficacious is really unknown. It's not like it's going to be the big cure-all for all motion sickness. It's best to use ginger extracts. At this point, I always get, well, how much ginger? So I always say refer to a veterinarian who is familiar with working with holistic medication. That's not me. I have not actually ever given ginger to my pets for motion sickness. So I would consult with a veterinarian who's well-versed in it, not Dr. Google. So someone who really knows. Ginger extracts as opposed to some products, because actually ginger snap cookies, ginger ale almost contain no ginger. So even in humans, they found that the ginger ale that you think is making you feel better probably isn't doing much, but the ginger extracts probably are having some benefit. There are some other herbs out there: Panax ginseng, black orange, chamomile, fringe tree, peppermint, meadowsweet, lemon balm. They've all been sort of documented, more so in human beings, that there is some benefit to alleviating the signs and symptoms of motion sickness. But the efficacy is debated in both human and veterinary medicine. We just don't have a lot of published information regarding their safe and effective use in dogs. In fact, some of these are very limited studies of animals taking. Like, I would not be comfortable just doing a ton of lemon balm in my dog. I don't know what the side effects are. So again, always consult with a veterinarian who's well versed in such things, and that's not me. So what is your role as a veterinary technician or a veterinary assistant, or if you're a front desk and you're listening to this, even a veterinarian, what is your role? Well, if you're a veterinary technician or assistant or even the front desk, you have a cool job. You're the first person that the client speaks to, right? If you are in those roles, you sometimes get to help clean up the dog and the car too. Owners are just really distraught, right? They're just so sad. They have this dog. They always get upset about it. Nobody comes in smiling. Unicorns aren't flying around their heads when they say the words like, oh, he just vomited all over the car. No, their car's ruined. They get very upset about it. they feel bad for their dog too, you know, and that relationship's destroyed. So you can really help the pet owner bond. First and foremost, there are options. So if you're up at the front desk, which is the hardest, we were just talking about how that is one of the hardest, toughest jobs in our veterinary hospital, right? If you're up at the front desk, if you are a veterinary technician or assistant, you have to say, does this happen every time he or she gets in the car? If so, let's talk to the veterinarian. There's a lot of options out there. Not every single treatment's going to work for every dog, just like every single treatment doesn't work for every single human being. So you can just ask at the yearly visit, does your dog get sick in the car? And if you have that amazing Zoetis handout for Serenia, just leave it there and just say, is he doing any of these things? Yes, he's the green dog or he's the red dog, right? It's just such a great visual reminder to start a conversation. Speak to the owner about systematic desensitization. Oh, he hates the car. That's your trigger right there, right? He hates the car. He hates going for car rides. Why would the dog hate going for car rides? The cat, I get it, right? In a tiny box and it only ends up at the vet clinic. But why the dog? They should love going in the car. My dogs love going in the car, right? So let's have that conversation about some stuff we can do to reduce the level of fear. They may grow out of it, absolutely, but we don't want to find out that we're a year, 2 years into this dog's life and, well, we could have helped it, but we just thought he'd grow out of it, right? So with motion sickness, it can become a lot worse. So I'm going to talk to you about, this is my friend's dog, Chicklet. So coworker of mine, and this was a while ago. So CERENIA had just come out. Chicklet was the candidate that we were going to try this new drug on, right? Because again, seeing is believing, right? So Chicklet is a 6-year-old beagle at the time, female spayed, 16 pounds, tiny little dog. She's adorable, right? And she has lived officially her whole life with motion sickness. Now, the nice thing about Chicklet is, bless her little soul, she happily jumps into the truck every single time. As soon as he starts the car, she starts licking and she starts yawning, and it's repeated behavior and he knows it's going to happen. She eventually starts to hypersalivate. She experiences huge abdominal heaving, and then she vomits all over his car 100% of the time. There's not a moment that Chicklet doesn't vomit in his car. She always vomits, interestingly enough, in the first 5 miles. That's how predictable Chicklet is. This is literally what he said. It's heartbreaking. I don't take her to as many places as I would like to because I don't want to deal with the motion sickness. She maybe goes on a ride once a month. It's such a nightmare. And this guy loved the woods. He loved hiking. He enjoyed the outdoors. He got this little dog and he was like, we're going to go on walks and we're going to enjoy nature together. And Chicklet had other plans because Chicklet's like, I'm going to ruin your truck. So at this point, he basically rubber coated and plastic lined his entire back seat. She can only sit in the back seat. And he installed, you saw the little dog bed that she was in. So ideally she would just vomit in that dog bed. But he had rubber mats, he had fleece bed lining backing the seat. He had everything coated in plastic. The floor was covered in plastic and rubber lining. And everything was just, you could just peel it out, hose it off, and put it right back in for the next time that Chicklet decided to vomit all over the car. So treatments, diphenhydramine, not successful. So unfortunately he was like, we've already tried everything, not great. And he did try some other obvious things. He tried fasting her for at least 12 hours, which, can you imagine for a beagle? That is right there torture, right? Chicklet, I'm sorry, you can't eat for 12 hours. She's probably losing her little beagle mind. So she still hypersalivated, but because her stomach was empty, she would heave, but nothing would come up. So you can kind of see what the back of his truck looks like. So we've got fleece everything. He's got those pee-pee pads, those chucks everywhere. He's got car seat covers inches thick to try to prevent it. It's all machine washable or you can hose it off, right? So poor Chicklet has always lived like this. So we decided, let's just give this new drug a try, right? 8 mg per kg. We were like, I don't know. He was completely like, it's never going to work. So we used it as directed. It was given 2 hours before the ride. She was fasted 1 hour before that. And honestly, it was great. And he couldn't believe it. She never hypersalivated. So I said to him, here's this drug. Tell me what happens. And he brought her in the morning. Well, then we wanted to test out how well it worked, right? So 5 hours later, we fed her the biggest bowl of food she had ever seen at the veterinary hospital. And he drove her around. 5 hours later, there was still no vomit and still no hypersalivation. And so throughout the day, we would just say, okay, can you just get back in your truck with her and just drive around? So 22 hours later, there was actually still no vomit. She had some licking of lips, some yawning, but there was actually still no vomit, and he had continuously fed her this entire time. So he, needless to say, this was a game changer for him. And yes, while he needed to plan out doing this so that he could take her on walks and stuff, he thought this was just so great. And he, again, you can't do it for more than 2 days, but that was the biggest deal, right? So he would do it, and then he would give her a break for 2 or 3 days, and they'd go on another hike in the woods in 2 to 3 days. And she just loved it. It was the biggest game changer for their pet owner bond, right? So in conclusion, motion sickness in dogs, it's under-recognized, it's undertreated. Unfortunately, owners just kind of suck it up and deal with it, but they don't realize that we have stuff that we can help them with. There's tons of new advances in veterinary medicine. There's a lot of options. What works for one dog might not work for the other, right? So we definitely need to make sure that we try other things. If the owner says it failed, it doesn't mean it's the end of the road. Let's try something else out. And as a veterinary professional, it's important to speak to dog owners about motion sickness so you can help increase that pet owner bond. I know for me, I can't imagine what my life would be like if I couldn't put my dogs into the car every day and take them on a trail run. First of all, they drive me crazy, but I would be really sad. I always end my presentations with my beautiful children. My cat is not imaged here only because, well, it's an outdoor photo and she's an indoor only cat. But on your left is my littlest, newest guy. His name is Blitz. He's a mini Aussie with a tail. My old lady's in the middle. She is 15 and a half years old, going strong. And then my border collie, appropriately named Havoc, is on the right-hand side there. So as you can see, I've done a color theme. It was not intentional up until the third one. And then it was absolutely 100% intentional for a color theme. So I'm happy to take any questions, and I hope that I helped you guys out, and hopefully help some pet outs as well. So I'm open to questions.
That was so great. Thank you so much. And yes, you do have a few questions here. So quite a few, actually. Let's get started with them. One of the questions that we got was wondering if there's anything that you could say about motion sickness in cats beyond the mention of it that you had, saying there wasn't a lot of research. Is there anything you can do for an affected cat?
Yeah, that's a tricky one because there really isn't any data or studies out there, and I'm a huge believer in evidence-based medicine. So, we certainly know that you can give Benadryl, like diphenhydramine, to a cat, so that would be something that we could certainly try it in. Unfortunately, the maropitant is not labeled for use for that particular indication in cats. So that's a no. But certainly other things, making sure the air blows on them as far as vents go, in the car. A lot of times our cats in carriers are sitting up in the front seat, in the passenger seat with us in their carrier. We can put a vent right on them so that they can get fresh air. I mean, don't blow the kitty so they feel they're in a wind tunnel, obviously. But again, the not feeding them before 12 hours scenario, that sort of thing. There is probably, again, that small percentage of cat population that vomits due to motion sickness in the car, but because they're only getting usually in the car maybe once or twice a year, it's one of those things where owners are definitely not as willing to want to treat it because they're like, well, I can deal with this once or twice a year, when we probably should be putting a little bit more clinical research maybe into our kitty cats. Unfortunately, that's all I have for cats, and I do apologize because I'm a cat lover. I love wobbles. I've always had cats in my life, but yeah, it's just one of those things. They have a different relationship with us.
Thanks. Does the percentage of signs of motion sickness decrease when dogs, this was a dog question, are able to look out the window or ride facing the front of the car, facing the direction the car is going? Do those things help them as they help many humans?
Yeah, so as far as clients saying they help, yes. As far as huge studies go, no, because whenever we do a huge study, there's obviously a time commitment to that study to get that data, and the amount of factors we would have to factor in on a large enough pool where would it be data that matters hasn't been done. So we don't really know, if we take 15 motion sick dogs and then only provide them airflow with 1-inch crack of a window, whether or not that's going to help drive those studies, up or down. But owners will tell us that you know, oh, I have to leave the window open, or, oh, I can't feed him ahead of time, and he then never gets sick. So I think offering those things to the clients and making sure that they're aware that they can try those are easy, quick things. It's either going to work or it's not going to work, right? And going through all those different scenarios, I think is something that any owner can do. So I don't have data studies in terms of percentage, but we know that clients say it works.
And sometimes that's all we can do, right?
Yes.
um, do some dogs, even those who didn't have motion sickness as puppies or young dogs, start to get it due to aging? Is this something we see in senior dogs?
So it's not a common older dog thing, but can it happen? Yes, absolutely. So just like dogs can grow out of it, dogs can grow into it as well. Even in human medicine, you know, I know when I was, I mean, I just look at myself, you know, when I was 13 years old, or even 10 years old, you'd go on the most nauseating tilt-a-whirls at the fairgrounds. And you thought it was fun. And I made the mistake in my early 20s of going to a fairground. My friend and I decided to go on, I think it was called like the centrifuge. You all can derive what that means. And at the end of it, we both decided we were not 10 years old anymore, because we walked out of that ride like, I can't believe we didn't vomit. And the rest of the evening, my head was completely loopy. So I would imagine that our older pets have a similar experience. And I think if we're starting to notice those signs and symptoms, the drooling and the excessive heaving and the lips drawn back, you know, even excessive panting, you know, they don't want to get in the car, or true vomiting, that we may need to think, oh, maybe they are experiencing some of that. And let's work on that both behaviorally, making sure there's not an underlying disease disorder because they're an older pet, obviously, do a full workup, and then try out, you know, maropitant or another anti-motion sickness drug and see whether or not it helps, right?
Probably because it's a fear-free webinar. We've got many questions that are asking some variation on the following. Is there a component of car sickness, motion sickness, that is caused by anxiety, and will treating the anxiety help with the problem?
Excellent questions. So I kind of addressed it in one of the slides, but I didn't spend a lot of time on it. If it's a medical problem where it's related to an instability within the inner ear itself, answer, treating behaviorally will not help, because it doesn't matter even if it's the happiest, unfearful dog in the whole world. If the, you know, even if it's a cat, let's say, running into the car happily excited, they're going on a cat ride, it's not going to help the fact that medically there is some discorrelation between the eyes, the ears, the brain, and the vestibular system, causing them to actually vomit and experience motion sickness. What we can take away for these animals is the fear and the anxiety leading up to that. So in the case of Chicklet, for example, when I described her, she always loved the car ride, which is a small, amazing miracle, because I literally rode in the car with him and recorded her actually getting sick and vomiting and all the signs and symptoms that she went through before we started treating her. And she looked miserable, but yet she was the happiest beagle, of like, always an optimist. I'm getting in this car, and it doesn't matter if I vomit, I must be going someplace fun. So in dogs that are experiencing that nervousness, that fearfulness, we can alter the behavioral aspect of it so that they feel less fearful getting in the car. And to that fear, they can then learn, I don't want to get in the car, or I'm so nervous about getting in the car, I vomit because I'm so scared about the car. So animals can vomit just like people can because of fear. And the other thing is, then it can turn into aggression, right? They're backing out of the car, their owner's physically trying to shove them in. Dog turns around, is like, this is not happening, snaps at the owner. Owner yells at dog. Now dog turns around and says, you know what, I told you no the first time, and now we've got a bite on the hand, right? So behaviorally, we can edit those things with behavior modification and doing our awesome fear-free techniques, but medical is medical. And so we still have to treat the inner ear issue with drugs or airflow or, not feeding or things like that. But definitely excellent question. So yes, always combine it with fear-free, but in the end, they're still going to vomit because they have a true medical condition.
What about in your experience or based on any research you've seen, if you had a dog who as a puppy had motion sickness, and subsequently it was over, but they associated the riding in the car with bad feelings?
Yes, absolutely. So that is the key component. When I talked about making puppies rides super fun, because again, and I mentioned this, that we oftentimes just go, oh, they'll grow out of it. Well, we need to address the fear-based response because otherwise they might not grow out of it. I know one of our veterinarian's dogs, a golden retriever, she had as a puppy, and he started vomiting, true motion sickness, never vomited any other time. And she just kept thinking he's going to grow out of it. Started treating him with CERENIA, which was great because if we can reduce the vomiting, right, that reduces the fear response too. So that plays a hand in the fear-free response, right? If we can drop that level of, I don't feel so sick in the car, well, then they're more apt to get in the car. So her golden was the epitome, like, I don't want to get in the car. She started treating him with CERENIA. That worked amazingly well, but she did have to work on him with behavior modification because he is now officially 10 years old, still has motion sickness. And if she just ignored working on desensitization, that systematic desensitization, making car rides fun, she could have a 10-year-old golden retriever who's now fearful of the car. Instead, she has a dog who's super happy to get in the car, but we took away the medical condition by being able to treat it with CERENIA. So.
Well, I hope all the people who have asked these questions are satisfied with the way I combined them. We would be here all night if I asked all of them separately, and they basically overlapped in what they wanted to know. So thank you very much. A couple of more specific questions. One of them is, how long should the desensitization process take?
Yes, so that is up to the animal itself. So we have some pets and even some human beings who are able to desensitize to an adverse thing, an adverse stimulation, in this case the car, very quickly, right? Because they're food motivated, their fear level wasn't that strong, and we can very quickly get them from being fearful where they don't even want to get into the car to riding in the car and being happy about it, right? And then we have others where it may take months or a year, honestly, to get over that fear-based response. I gave the example of a spider. That's going to take me probably over a year of just systematic desensitization, being exposed to spiders every day. And again, a lot of chocolate. There's going to be a lot of chocolate in order for me to get over that. So if anyone would like to desensitize me to spiders, that would be fantastic, but I need a lot of chocolate. So it's truly up to the animal or the human being, in this case, the dog in the car, right? Every pet responds a little bit differently. How strong is the fear-based response? What does that pet, how long is it associated that thing as being bad? What does that look like? If we can catch it early on, it's going to probably be a shorter amount of time in terms of systematic desensitization.
Okay, great. What is the appropriate washout period between doses of the 2-day maximum 8 mg per kg dose of CERENIA?
Yes, great question. So I always tell owners, ideally, because you can only do it for 2 days, right? So I always tell owners at least 2 to 3 days in between. So in the case of Chicklet, I know he would go for 2 days of walks, and then he'd take off about 3 days, and then do another 2 days of walks, and then take off another 3 days. So I will have to say that I openly don't admit if we can shorten the amount of time in that. I would actually have to reach out to Zoetis or consult my rep on that just to be sure, double check. But yeah, we know it can only go 2 days, so I would probably have to double check that one. But we tell clients at least 2 days, ideally 3 days.
Okay, great. What if a patient experiences other issues with the car than vomiting, such as diarrhea or even urination?
Yes. So the diarrhea and the urination are probably based off of a fear-based response if it's in conjunction with motion sickness, right? So they've gotten themselves so worked up, it's such a miserable experience at this point that they're having full-blown GI symptoms. Human beings, well documented, animals, well documented. We see a lot of stress diarrheas in our boarding facilities. So if you've ever worked in or around a dog kennel, there's a lot of diarrhea, a lot. So for that reason, we know that when our pets get upset, they can experience huge, massive GI dysfunction because they are nervous. And people have the same thing. If you've been ever so nervous in your lifetime, you actually have diarrhea. Please don't tell me that, but it's a very well documented thing. So the animals urinating in the car out of fear, having diarrhea because they've worked themselves up that they're now having diarrhea in the car. Obviously, we want to make sure they don't have another medical condition, but if this happens only in the car, this is a fear-based response. So how do we get rid of that fear-based response? Once, we have to stop the vomiting, right? And the absolute drooling and the motion sickness signs. You feel really bad for that animal because that's why it's so scared. It's doing that abdominal heaving. It's a pretty miserable response every time. So if we can treat medically the vestibular issue of this component, that will allow the door to open up for behavior modification where we can now treat the fear on this. And we do that again through that systematic desensitization of like, hey buddy. And if we've got a dog that is that fearful that they've involved their whole GI track at this point, we're probably going to have to just start with, let's look at the car and not pant over it, you know, because there's probably some level of anxiety even walking to the car. So we have to make walking to the car fun before we get in the car and make that fun. But again, if we don't take away the medical signs of motion sickness by using CERENIA, by using something else that works for that dog's just going to continue to have that fear-based response because we didn't do anything different, right? It's still a miserable experience. So, but yeah, that's a very sad dog.
Is motion sickness anything like idiopathic vestibular syndrome?
Good, great question, because we get this a lot. Can we use the same dose in our idiopathic vestibular system? We get that question a lot with owners who are experiencing it. What can we do? Because to some level, yes, and some level, no. I think that from a medical standpoint, thus the root of the name, right? Idio, meaning we have absolutely no idea. So idiopathic vestibular syndrome, some people call it rolling dog syndrome. We don't know what causes it, but we do know it has some dysfunction between the vestibular system and how it's working with the brain. The interesting component is that there wasn't previous motion causing this to occur. So there are two totally different syndromes. When we tend to use CERENIA to treat the vomiting and the gastrointestinal effects of the idiopathic disease, we tend to use the lesser version in our veterinary hospital. We do not use the motion sickness version on it. And we feel like that the lower dose for the sub-Q CERENIA tends to work just as well for those dogs experiencing idiopathic vestibular syndrome as it does for if we were to do a motion sickness dose. So we always go lowest effective dose. So in these cases, we just treat lowest effective dose. There isn't any motion. It's just that it feels like, I'm sure they have motion because of the nystagmus and their eyes are bouncing back and forth, and it must feel like they're on a really bad cruise ship, right? But we find clinically they do just as well with that lower injectable dose of CERENIA as opposed to giving them that huge high dose of motion sickness. The other thing it allows us to do by giving us that lower dose is now we can treat for multiple days, 3, 4, 5 days, as opposed to pigeonholing ourselves into an oral dose. Since they tend to be sick to their stomach anyway, if we were to try to get it into them, that motion sickness high 8 mg per kg has to be given orally. These guys don't want to eat anything anyway, so now we're jamming a pill down their throat. So yeah, that's a great question because we always get asked that too. I think there's probably in terms of the vestibular system some correlation, but they are two totally different things because again, one's caused by motion. The other one, the dog was on ground that was not moving. Something went haywire inside their vestibular system and now they feel like the world is moving. It is different, but and we treat them differently for that reason. So hopefully that answered that.
Yeah, no, that is a great question. I was really eager to hear your answer.
Yeah, it's a really good question.
Yeah. Is there any blood work that's recommended for dogs who are on long-term CERENIA?
So at this dose, they can't be on it long term. As far as the injectable dose or that sort of thing, again, they're usually not on it long term. If they're on it long term, it's patients that are experiencing, you know, a lot of vomiting from things like, you know, cancer or stuff like that. There is no there isn't any current recommendation on doing blood work, but obviously if they're needing to be on it because they've been vomiting due to a disease process, you're probably doing blood work anyway. Now, with that said, in the package insert, it does warn against any sort of dog that might have some liver involvement, that you should use it in caution. So I would say this: if you have dogs that have elevated liver enzymes, that you would probably want to consult with your Zoetis rep, just double check, see what's going on, consult with a veterinarian. That sort of thing, if we're going to be using it at that high rate for motion sickness. So
could you, I'm trying to condense this question down and make it shorter. Could you talk at all about the differences between anti-nausea medications such as ondansetron and CERENIA in terms of, does it have a completely different mechanism that would make CERENIA more appropriate for motion sickness?
yes. So as we were talking about the neurotransmitters and the receptors, we have to have a receptor combined with a certain neurotransmitter in order to make the animal actually vomit. So the point of every one of the drugs, from ondansetron to diphenhydramine all the way to CERENIA, is to block one of those neurotransmitters against one of those receptors. So it basically puts a shield up so they can't put the pieces of the puzzle together. Now, ondansetron works on a completely different receptor and neurotransmitter than CERENIA does. The one that CERENIA does is substance P, and it blocks it against the NK1 receptor. So we're taking substance P and making sure it never fits the piece of the puzzle of NK1. Now, when we look at, you know, the overall efficaciousness of it, a lot of the vomiting actually starts with substance P. And this is why when CERENIA came out, it seemed like such the miracle drug, because we finally found a drug to block, that substance P connecting with the NK1 receptor. Prior to that, there wasn't such a drug combination. And so that's why a lot of the vomiting, not all the vomiting, there's no perfect drug, but a lot of the vomiting stops because it tends to be one of the first neurotransmitters that connects with that particular receptor. But ondansetron, similar thing, completely different neurotransmitter and completely different receptor. So again, what works for one animal might not work necessarily for another animal, but in terms of motion sickness, there are three that are hugely cited. Histamine's one of them. So again, that's why Benadryl works pretty well. And then again, substance P and the NK1. So if we can block them, yeah, absolutely. Those are the ones, there's three that are cited for motion sickness. So yeah,
Okay.
great question.
Great. All right. Well, that is the end of our presentation, the last of our questions. I'm sorry for anyone whose question we weren't able to get to. But this is all we had time for. I want to thank you so much for being with us tonight, Ms. Newfield. This was amazing, and I learned a lot, and I'm sure everyone else did too. I want to also once again thank every one of you for being here this evening or this afternoon if you're in California or Hawaii or the West Coast. And one last time to Zoetis for making this presentation and Fear Free itself possible. They are a long-term and very valued sponsor of Fear Free. We really appreciate their support. For those of you who are here attending the live webinar, I will be sending out the CE email in a few minutes. And please remember to email me at fearfreepets@gmail.com if you don't receive it. The CE survey is only open until Tuesday afternoon, so please take it right away. Don't wait till the last minute. And that is it, everyone. Thank you so much and good night.
Thank you so much. Have a good night.